All right. So when I became CEO, we had a lot of discussions, even from the team perspective, and definitely with the board, that if we're going to move forward as an organization, we definitely needed to get a new strategic plan in the works. And one of the things that we decided we needed to know is exactly who everybody in this room is. And we wanted to make sure, if we were going to create a new plan, that it really addressed the needs of our member organizations. And Karen was here for a really, really long time. And she knew all of you really well. And that comes with history, and it comes with time building relationships, and she was great at it. I have not been around for that long. So, and when we look at my my staff team, even over there, a lot of them, we have less than 2 years with the coalition. So it's like, how do we get to know all of you really well? And so we did this really the old-fashioned way. We picked up the phone and we talked to you. And we had those conversations instead of making you fill in an online survey, just because we think conversations are just a nicer way to figure out what it is you're all doing and to get some good information. And if you brought up a certain thing on a phone call, we could ask more questions so we understood. Now, I want to be really, really clear. We didn't do any of this so we could judge you. We're not trying to rate how well you're doing. It really is more like when you meet somebody over tea in a coffee shop and have a conversation as you develop a friendship. That was more the intention of this, just so we're really, really clear. But we also want you to understand what it is that we noticed about our members in general. So we're going to do a quick overview of what we learned here. So obviously, we're a global network of patient groups. We're divided loosely into regions, and these are the regions that we work within. And we have now 82 member organizations in 52 countries. We know we didn't get to talk to each of you. We've had some new members come in since then, since we did these conversations. And as well, we know people were busy and they didn't always respond to us when we reached out. That's okay. We're going to keep trying, just so you know. If we didn't talk to you, we still might call you up and have a conversation one day, because we are really, really interested in what you're doing. Part of why we're interested is we get calls from patients. We get social media posts from patients. And if we're going to redirect them back to your group, we like to give them really good information about what they might be able to get in terms of support from you, as well as making sure if we hear from a new group or one of you calls and said, I really need help with this kind of project, we can also let somebody know, you know what, there's a really good program happening with SARP in Turkey. You should reach out and talk to him. All right?
Just a question. Will you share all the slides afterwards?
Yes, we will share the slides. Those little stars are just showing where our staff team is located right now. All right, so Natasha's in the middle there in Spain. A number of us are in basically just outside of Toronto in Canada, and then Prue is in Auckland, New Zealand. So seriously, this was just about who are you. It was nothing else, and you know, nothing brings people together like music. In case you don't know and you're really young, that is The Who. So most of our groups, we found out, were created in the decade of the 2000s. So you have some history in what you've been doing. We are spread out. There are some newer organizations. There are some organizations that have been around since the 1940s. So there's people that have been around a really long time. But most of you have about somewhere between 10 and 20 years experience. When we looked at how you were operating, about 70% have paid staff. This isn't a quantify. I'm not going to tell you how many paid staff, but it is at least one paid person working for the organization, with about 30% who are running completely on volunteers. We asked if you had a board of directors, and it's good. Most of you have a board that you're working with. I know that comes with some challenges sometimes, but it's good that you have that governance structure in place. Of course, I don't mean my board, you're all fabulous, but I'm just saying in general, right? It's good to get lots of diversity and opinions coming into your organization. Then we asked about medical advisory board, and only about half of you have a medical advisory board. Again, this is not a criticism, we were just curious, because what that means for us is if you're not able to get a medical advisory board locally for whatever reason, maybe we can help by making sure that your materials are vetted or you have really good information to work from when you're communicating back to your patients. We asked about your funding sources. Partially this comes out of the fact we were just curious. We hear comments about difficulties now accessing pharma funds, and in some countries there's a very negative connotation about having pharma funding, and we know that there are a number of groups who are trying to restructure where they get their funding from. But still, the majority of our groups right now receive some kind of pharma funding, so 85% is a significant amount, right? There's lots of other activities that are happening. Most of it involves individual donations, so you're working with your patients and other people that are interested in your groups to secure some funding. We were curious, of course, as to your focus within lymphomas. So in this first one, we were just curious if you worked with lymphoma and CLL, just CLL, or just lymphoma. The majority, obviously, are working with both lymphoma and CLL patients and caregivers. We also asked about the age of the patients. So about half of you are working with patients of any age. There's a further 30% of you that are just working with adults, and then the rest are working with adults and teenagers. The reason we ask this is right now, the work that we do and the materials we produce are really focused on the adult population. Partially it's because the majority of our patients are in that older age group, and that's how the coalition has developed. But moving forward, it's just a consideration for us if we should start engaging with the pediatric community and getting you some information about that. We also asked about if your focus was completely on lymphoma and CLL, or if you do other types of cancer, other types of work. So you can see from this, it's 55% of you are engaged in more than lymphomas and CLL. So then we asked you what you thought are the main issues for your patients. And the number one thing is that you say your patients don't have good information. So they're reaching out, or you see that they should be reaching out because they need better information about their diseases. The second issue is they're having a hard time getting access to the treatments that they need. We go down the list. The third is a lack of psychosocial support. Number 4, there was a tie here between patients are having a hard time getting diagnosed, or they're having a hard time accessing clinical trials. And the last reason is financial stress. We compare this, though, to what the Global Patient Survey tells us. And when we asked about information, you can see definitely the majority of patients, over 60%, said that they would have liked more information. So there's no doubt that this is a big area of need for our patients. But then we asked what else were issues from a patient perspective, and they still list the same issues, but the issue that was more important to patients from the Global Patient Survey was financial concerns. And this doesn't mean that the information you're reporting back to us is wrong in any way. It just means probably the patients that you're connecting with are those that have the focuses that you told us about, but there's still a lot of other patients out there that are probably in need of some support and don't know where to go, right? We know that there are a lot of patients that don't find our organizations, and there's some work that needs to be done there. We asked about the types of programs that you're doing. So these are just grouped by advocacy, awareness, education, and support. We know there's some crossover between support programs that sometimes it's a support program and it gives education at the same time. So we had to make a little bit of a guess where we put some things. But What's interesting here is we obviously see a lot of work in the education and support area. If we put in this baseline about half, showing the halfway line, you'll see really the focus is on education materials, it's on education seminars or conferences. There's lots of work in organizing patient group meetings or support group meetings, and a number of people are doing one-on-one mentoring. When we look in awareness, most of you are on social media and you're busy with that activity and doing some other awareness programs, and many of you are doing some kind of advocacy. When we asked you what you were really, really good at, most of you said you're good at producing literature. So you're good with patient brochures or leaflets and booklets. That's what you think you do really, really well. When we ask what you're not that good at, even if you're doing it, you said advocacy. Then we asked another question about your advocacy efforts, just to understand a little bit more what you were doing. And about 1 in 5 are doing HTA, health technology assessment, or regulatory work to try and get drugs approved. Most of you are doing individual patient advocacy. So you're working with patients one-on-one to get them extra support or the extra care they need, rather than working at a higher level. So really, what we just want to say is you're all doing a great job. It's a lot of work, and we know it's a lot of work. But we also know everyone needs a little help sometimes. So we also asked some questions about where you're struggling. So we asked where you think your organization, what are the things that you do where you could need some more help? We didn't say if you needed help from us, we just asked where you needed more support or you needed to focus more efforts. The first thing you listed was fundraising, right? People are trying to find different revenue streams, more money so you can offer more programs. This is not really a surprise. As well, though, tied in that first spot was getting good information on treatments and also good information on clinical trials and what's available in your countries. The next, there was 3 things that tied next where you said support was needed. One was in social media. We saw on that previous slide a lot of people are involved in social media, but you're not really confident you're doing it well, or just need more hours, more people to keep up with the demand of social media. You need some support with leadership and advocacy skills and making your organization sustainable. And then you can see the rest there, working with pharma, etc., right down. But then, what's interesting, there is when we talk about the translation, and you'll see the translation is at the bottom of that pyramid. I just want to be clear, when we were talking to groups, we had more groups that have people that are really comfortable speaking in English respond to us, which is not a surprise. Natasha spoke to some groups in Spanish because she has that ability, so that helped us with that community. But we also recognize there are probably more people that need help with translation. It's just that they didn't talk to us probably because they didn't even really understand what we were trying to do with our email or phone call asking if they would talk to us. So we do recognize that's a weakness here. Then we asked specifically what the Lymphoma Coalition can do to help you. And it was very clear that you really like the best practice sharing. You wanted to hear what the other groups are doing. You want to be able to network together and learn from each other. You also want us to advocate to policy and decision makers. And I want to be really clear here. This was not saying we want you to train us so you, the members, can advocate. You wanted us as the coalition to take a role and start advocating ourselves on global and regional levels. You want definitely some more lymphoma education. You want us to facilitate training like we, get together like we do here. And then at the bottom, you'll see education materials, equal access to care, and WLAD. So what I do want to point out with one thing here is the survey did make it on the list, the Global Patient Survey, but it's further down. I didn't list everything. There were too many things. But for us to actually help you with advocacy or to do advocacy ourselves, we need to do that survey. So we're going to spend some time talking about that during the time tomorrow morning, actually, about how we use that and what it's going to look like for the upcoming survey that's happening in January 2020. So this is obviously where most of you said that we can help. But when we also then asked you what is the best thing we could do, you picked this. So it was just an interesting point for us that really a focus was still equal access to care, even though really then when we said, what can we do? You're like, oh, we love the networking, we love the best practice sharing. So what is different for us is as a coalition before, we have not done a lot of advocating on a global or regional level. We do it to a degree more in Europe than anywhere else, just because of the systems allow us to easily do that. But it is something that we took to heart when we were making the strategic plan. So any questions on that? Just a quick break. No? Ken?
One of your presentation slides, I find that the financial stress comes the last in terms of the patient issue. Does it mean that because I'm totally a stranger to lymphoma, so I'm not sure whether the treatment is not that expensive compared to other blood cancers?
No, treatment is expensive. So I think it was just like an order of what our patient group, our patient members said that patients were calling them about, right? So what the patients were telling them was their biggest need. And most often it wasn't financial issues. But then if you remember when I told you when we asked at the Global Patient Survey what the patients themselves mentioned, finances was still very significant. So it's not that it's not important, it's just that the members are not hearing about it as much as we see the patients talking about it.
Thank you.
Okay. Hello.
This was a really nice overview, but maybe I missed it because you talked about discussions with pharma and with individual patients, but how about discussions with health professionals?
So this, you know, you are our primary audience, right? So, and when Susan talks about the strategic plan, we have different audiences that we've defined for the Lymphoma Coalition, but you, the members, are our primary audience. And it doesn't mean that we're not going to do work that's specific to healthcare professionals, and you'll hear that in the strategic plan, but we really wanted to know what you needed from us. We are having conversations with healthcare professionals as well, but it wasn't as big a priority to do, so those are still happening.
Hi. I want to touch on a couple of points. First of all, the education. There is no question that for patients, education is the most important. We saw it clearly from your great presentation. The question I'm asking is, does the Lymphoma Coalition plans on taking the responsibility of producing educational material that can be translated to many languages, or they plan to leave it to each organization in their own country? Because what's happening now is that we are trying to work among ourselves. Or when I'm producing now lymphoma, I'm using the material of the Lymphoma Action with their permission. And the question is, should the network or the Lymphoma Coalition take charge of that and have one set of information? Of course, needs to adapt to each country. The second one is, which is not less important, is HTA involvement. We are struggling and fighting to get patient engagement in HTA, even in my country, in Israel. The only thing that they are willing to do now, open the door, is to have patients write letters to the HTA committee. So now we are struggling of gathering the information. So I think it will be very, very helpful for the patient organization in all the countries. There are many new drugs coming, and there will be more coming. And we need the information of the patients using the drug, what is the drug doing to their quality of life. And together that information, I think, will be very much beneficial if the coalition as a coalition can help gather this information, and then we can use it. I approach Natasha. She's trying to help as much as she can, but it's still a struggle. So I think this is extremely important for the coalition.
So if I can just answer really quickly, yes, to your answer to both. And so Susan will address that when she starts talking about what we're doing through the strategic plan. Yeah. Hi, Tone.
I just want to add something to what you just said, because in Norway we have an example with multiple myeloma. That's one of our diagnoses. We had some patient material, but it wasn't really very specific and detailed. Then we got help from IMF, International Myeloma Foundation. They had a very good booklet, and I translated it into Norwegian. And I was really surprised. So we had ratings from our huge patient meetings. So patients said what were they most appreciated about. And that was the book. That really was a very proper book with very many information that we as a small organization had no chance of producing at all. So if you could help us with that, that'd be very helpful.